Raising awareness of sexually transmitted disease, STDs. Signs and symptoms of STDs. Sexually transmitted disease or sexually transmitted infections can show themselves in a variety of ways, including no symptoms at all. As a result, they may be undiscovered until problems arise or a partner has been diagnosed. The following are signs and symptoms that might suggest an STI: painful or burning urination, unusual or odorous vaginal discharge, and pain during sex, and many more. Factors that may raise your risk: having sexual contact with a variety of people. The higher your risk, the more persons you have sexual contact with. Having a history of sexually transmitted infections. When you have one STI, it's simpler for another to take hold. And the last one is having to participate in sexual behavior because you're compelled to. It's tough to deal with rape or assault, but it's critical to visit a doctor as quickly as possible for screening, treatment, and emotional support. Possible complications include pelvic pain, pregnancy complications, eye inflammation, arthritis, pelvic inflammatory disease, infertility, heart disease, and certain cancers, such as HPV-associated cervical and rectal cancers.
Protection and preventions. Some of the information I discovered is that the Food and Drug Administration shows that millions of people in the United States contract an STI each year. Using condoms during sex reduces the risk of transmissions of most STIs, including gonorrhea, chlamydia, syphilis, and certain types of hepatitis. One of the many important factors to remember is that condoms do not provide 100% protection when it comes to sexually transmitted diseases and only reduces the potential risk. Other prevention measures include abstinence, vaccinations, reducing the number of sex partners, male and female condoms, and dental dams. Safety measures of condoms. Use a condom every time you have sex. Read the package and check the expiration date. Make sure there are no tears or defects. Store condoms in a cool and dry place, and use water-based or silicone-based lubricant to prevent breakage. Facts and myths. Myth 1. An STD resolves on its own. The facts are the majority of STDs do not go away on their own. STDs have long-term side effects and health risks, so seek treatment as soon as possible. Myth 2. You can't get an STD if you only have oral sex. STDs are easily transmitted via all types of intercourse, including vaginal and oral.
Testing and diagnosis. The key to staying healthy is understanding how STDs spread and how to avoid them through regular testing and talking with one's partner. Although many people may be embarrassed or ashamed to ask for an STD test, it is highly encouraged and important to reduce the spread of the diseases while keeping everyone safe and protected. Only 12% of teenagers and young adults responded to a 2013 nationwide survey so that they had an STD test in the last 12 months. Overall, the level of testing was significantly higher among women than men. The majority of sexually experienced participants who have ever had an STD test reported having had their most recent test at a physician's office. The remaining had gone to a family planning clinic, community or health department clinic, school-based clinics, STD clinics, or other type of facilities. The Tammy CC Health Center Services provides testing and treatment for sexually transmitted diseases. A specially trained staff offers educational programs and counseling for students seeking information on sexual health. All services and patient interaction at the University Health Center are held confidential. Everyone is encouraged to go get tested if you are sexually active. They can test for chlamydia, HIV, gonorrhea, syphilis, herpes, HPV, genital warts, and hepatitis B. The line chart displayed shows the weekly reported STD cases in 2020 compared to 2019. After the COVID-19 stay-at-home orders in the spring of 2020, the number of STD cases tripled the number from the previous year. And here are a few clinics in the Corpus Christi area. And here are the references we've used throughout this presentation. Thank you.